Good evening, class. I am Normae Sixto. I heartily welcome you all in our night session. Are we all present?
Yes,
Yes,
ma'am.
ma'am.
Okay, very good. So, very nice time to all of you. Are you ready to learn another lesson for today? If you are, let's begin. So, before proceeding in our discussion, listen to the rules that we should acquire throughout the discussion. So firstly, kindly turn on your cameras. I'd be able to see your faces during the discussion, and kindly turn off your microphones. Unless you'd like to speak or ask a question, you are free to do so. So now that you've already turned on your cameras, who would like to read the quote that you can see on the screen?
Javier po.
Okay,
A
Javier.
beautiful, a beautiful day begins with a beautiful smile.
Yes, a beautiful day begins with a beautiful smile. So let's begin our discussion with those beautiful smile. Can I see your smile, please? Yes, look at those. So we're going to tackle the male reproductive system. But before that, let's have some fun. This game is called Factor Bluff. I know for sure that you are aware with this game. So to test your knowledge about what you've learned from the past lesson, let's have a game. So all you have to do is read the statement thoroughly and determine if it is a fact or bluff. So let's begin. Who would like to answer the first statement?
Javier po.
Okay, Javier.
This is where urine comes from. It's sweet just above the vaginal opening. It is fact po. Urethra.
Are you sure? Are you sure?
Yes, ma'am.
Okay, let's see if it is correct. So the answer is fact. Very good. Next statement. Vulva is the female external sex organ. Who would like to answer?
Me po. The answer
Yes,
is
Cherry.
fact.
Facts. Let's see. So it is correct. Very good. Next statement. Hymen is a small sensitive protrusion that's comparable to a penis in men. Is it a fact or bluff? Would like to answer? Yes, Sir Nicholas. Okay, let's see. Yes, very good. The correct answer is clitoris. Next statement. Clitoris is a piece of tissue covering or surrounding part of your vaginal opening. Is it a fact or bluff? Would like to answer?
Ma'am Kyle po.
Okay, Kyle.
I think it's bluff because the answer is hymen, I think.
Okay, let's see if it's correct. Yes, very good. The correct answer is hymen. So, last statement is a vagina is a muscular canal that joins the cervix to the outside of the body. Is it a fact or bluff? Oops.
Javier.
Is it a fact or bluff? Would like to answer? Okay, Javier.
Fact, fact po.
Let's see. Okay, very good. So now that I knew that you've learned from our past lesson, let's have another game to test your prior knowledge. So this game is called puzzle. So all you gotta do is read the statement thoroughly and determine fix the jumbled letters into words. So let's start. Who would like to answer the first statement?
Kyle, ma'am.
Kyle, yes, please.
The organ used for urination and sexual intercourse. I think it's penis.
Let's see. It's accurate. The correct answer is penis. Next problem. would like to answer? These are a pair of egg-shaped glands that sit in the scrotum. What do you think it is? Yes, Sir Nicholas. Let's see. Okay, very good. The answer is testis. Next problem. Scrotum is a loose bag of skin that hangs outside the body and behind the penis. It holds the testis in place. Who would like to answer?
Kyle, ma'am, again.
Kyle, yes? Okay,
Yeah, it's scrotum.
let's see. Okay, very good. The correct answer is scrotum. Another one, it is a tube that extends from the bladder to the external opening at the end of the penis. It carries both urine and sperm. What do you think it is? Would like to answer?
Javier po.
Yes, Javier.
I think it's urethra po.
Let's see. Okay, the correct answer is urethra. So I'm very impressed with your answers, guys. So let's proceed in our discussion. We will be tackling the male reproductive system. So let me state to you the objectives. At the end of this lesson, the students should be able to first identify the parts of the male reproductive system, second, explain the function of the parts of the male reproductive system, and lastly, value the male reproductive system. So, the male reproductive system. What do you think is the purpose of the male reproductive system? Who would like to answer? Who can share the ideas? May I call on Sir Hill? Okay, very good. So the purpose, yes. So the purpose of the male reproductive system is to produce and to supply sperm. Do you get it, guys?
Yes, ma'am.
Okay. So when we look at its external anatomy, you can see there that there is a scrotum and the penis. So the scrotum, it is the loose pouch-like sac of skin that hangs behind the penis. It holds the testicles or the testis as well as the nerves and the blood vessels. Now, inside of the scrotum is the testis. Now, this is where we should begin a discussion because the testis is the site of sperm production. Now, when we look at the testis and have a look inside, you'll find that it is made up of individual lobes, and within each lobes, you'll find something that is called seminiferous tubules. And inside of those tubules, it is just convoluted tubes inside of the testis. Now, inside of the seminiferous tubules, there are two major cell types. These are the Leydig cell and the Sitolis cell. Next, the role of the Leydig cell is to produce the testosterone. And on the other hand, the Sitolis cell, it produces androgen binding protein. So the androgen is a male sex hormone by testosterone. So it binds the testosterone if they bind together. What they do is to promote the sperm production or the production of sperm. That's why the testicles or the testis is the site of the sperm production. So moving on, when the sperm is being produced, it will be transported into the epididymis. So the epididymis has three roles. Can you please read the three roles of the epididymis, Ms. Cleo?
The three roles of epididymis is storm sperm, mature sperm, and transport sperm.
Okay. So those are the three roles of the epididymis. So when the sperm is matured enough, it will be transported into the next tube. This is what we call the vas deferens, or it is also known as the ductus deferens. What it does is to transport mature sperm to the urethra in preparation for ejaculation. So if you ever heard of a vasectomy, vasectomy is a suffix word. It means to cut. So if a male doesn't want to produce children anymore, he can have the vasectomy. So therefore, when the sperm is being transported through the vas deferens, it will loop around that loops around the bladder. And by the way, the bladder is just part of a urinary system. So it will loops around the bladder. It will join together with the gland right here. This gland is called the seminal um, vesicle. What it does is to produce an important, really important fluid. It actually produces a two-third volume of semen, and one of its major components is that of fructose, which is an energy source. So fructose is very similar to glucose. It is what sperm uses as an energy source. So gentlemen, eat your fruit. So seminal vesicle, it produces the seminal fluid. It mixes with the sperm and it now enters the ejaculatory duct right here. So it will merge together with a part of the urethra, which is coming from the bladder,
Sperm and
and it forms the prostatic urethra. Now this is structure right here is what we call the prostate.
sperm.
So you can see the prostate has both ejaculatory duct, also the urethra. So the urethra is going to be sharing a path that has urine and semen. Now, the next one is the penis. So the penis has three parts. These are the root and body and the glans. Glans is the head of the penis. You can call it glans penis as well. So it is a male organ for sexual intercourse and urination. So moving on, what do you think? What can go wrong when you do not take good care of your reproductive system? What will happen when you do not take good care of your reproductive system? Anyone who would like to share their ideas? So, yes, Mr. Kyle.
I think possibly you can have a prostate cancer.
Okay. What else? Yes, Sir Hill.
Javier po.
Yes. Yes, Sir Hill.
Javier,
Okay. Very good. Next. What else?
Javier, ma'am.
Okay,
If you
Javier.
don't care about your male reproductive system, it can cause skin irritation po.
Okay. What else? Yes, Kyle.
It can also cause genital herpes.
Okay. What else? Yes, Sir Hill. Okay, very good. Another? What else? Okay, there's none. So let's move. So all of your answers are correct. So one of the diseases or cancers that you can have or the complications that you will have if you do not take good care of your male reproductive system is the sexually transmitted infection. So can you please read the definition of STI, Miss Cleo?
Ako na
I'm
lang.
sorry, you're not audible, Miss Cleo.
Sorry po.
Okay.
Sexually transmitted infection is a various or various and bacteria, fungus, or parasite people can get through sexual contact.
Okay, thank you. So the sexually transmitted infections are diseases that are transferred through, mostly through sexual contact. Pathogens that enter the body through the reproductive organs produces STIs. But many STIs are also transmitted by bodily fluids such as blood. So some STIs, for example, can spread through the use of a shared tattoo needle, and some STIs can also be passed from mother to child during birth. Now, STIs are more common in teens and young adults than in older people. Now, one reason is that young people are more likely to engage in risky behaviors. They also may not know how STIs spread, and instead they may believe in myths about STIs like those. If you're sexually active with just one person, then you can't get STIs. But the only sure way to avoid getting STIs is to practice abstinence from sexual activity, right? So if you don't have any symptoms, then you don't have an STI. So many STIs do not cause symptoms, especially in females. So getting STIs is no big deal because they can be cured with medicines, but only some STIs can be cured with medicines, others cannot be cured. So a number of STIs are caused by bacteria. So the bacterial STIs can usually be cured with antibiotics. However, some people with bacterial uh, However, some people with bacterial STIs may not have symptoms, so they fail to get treatment. And on the other hand, we have the antiviral drug. So if you have herpes or HIV, you'll be prescribed an antiviral drug. So you'll have a fewer herpes recurrences if you take the daily suppressive therapy with a prescription antiviral drug. So you have a fewer yes. However, it's possible to give your partner herpes. So antiviral drugs can keep HIV infection in check for many years, but you will still carry the virus and can still transmit it. Though the risk is lower. So the sooner you start your HIV treatment, the more effective it is. If you take your medication as directed, it's possible to reduce the viral load in the blood so it can't be detected. So at that point, you will not transmit the virus to your sex partners. Next, we can have prostate cancer. Um, can you please read the definition, Mr. Hill? Okay, thank you. So the prostate cancer, um, it may cause no signs or symptoms in its early stages, but prostate cancer that's more advanced may cause signs and symptoms such as trouble in urinating, decreased force in the urine, a stream of urine, blood in the urine, blood in the semen. You can have bone pain and you will lose weight without even trying, and an erectile dysfunction may occur. So the average age at which men are diagnosed with prostate cancer is 70. So the prostate cancer typically is such a slow growing cancer that elderly patients may not require treatment. Instead, the patients are watched carefully over the subsequent years to make sure that the cancer isn't growing and posing an immediate threat. So this approach is called the active surveillance. So it is used for at least 50% of patients who are expected to die from other causes because their prostate cancer causes symptoms. So on the other hand, the treatment of younger patients or those with more aggressively growing tumors may include surgery to remove the prostate. They may undergo chemotherapy or radiation therapy. Next, we have the testicular cancer. Will you please read the definition, Mr. Kyle?
Testicular cancer. It is a growth of cells that start in the testicle. Cure. The basic types of treatment for testicular cancer are surgery, radiation therapy, and or chemotherapy.
Thank you. So the testicular cancer is rare and it most commonly affects the young adults or young individuals. So the testis, the risk of testicular cancer is about 4 to 5 times greater in individuals of European than African ancestry. So the cause of this difference is unknown. So the testicular cancer, and by the way, the testicular cancer has one of the highest cure rates of all cancers. Do you think that it's a good thing? So generally, the initial treatment is surgery to remove the affected testis. So if the cancer is caught at an early stage, the surgery is likely to cure the cancer and has a nearly 100% of 5-year survival rate. So a little trivia. Did you know this disorder, the aphalia? Not yet. So the aphalia, it is a disorder which is the aphalia or penile agenesis. It is a rare case of genitourinary system, which has an association with upper urinary tract disorder. It is a failure of fetal genital tubercle formation in the embryonic period. The incidence of aphalia, according to previous studies, is about 1 in 10 to 30 million births. So aphalia, it means the absence of the penis. So it is a rare condition. The symptoms of aphalia includes not and testicles. So moving on, how will you keep your reproductive system healthy? Who would like to share their ideas? Yes, Mr. Kyle.
Quit smoking. If you're smoking, you should quit smoking in order to
Okay,
keep your reproductive system healthy.
okay, very good. What else? What can you do to keep your reproductive system healthy?
Javier po,
Okay, Miss Javier.
dapat is mag-start ka na for your healthy lifestyle po.
Okay, you should have a healthy lifestyle. What else? Yes, Mr. Kyle.
Get enough sleep.
Okay, what else? Do you have an idea, Mr. Hill? Yes, very good. So, the reproductive system, it is an essential component of the human body and is essential to the survival of the human species. So both men and women must have a functioning reproductive system in order to conceive and have a children. It is important for both general and physical and mental wellness. So very good, guys. So let's have another game. It's ga- this game is called State My Name and Function. Who would like to answer the first letter? Yes, Sir Hill. Okay, very good. Your answer is correct. Who would like to answer the next letter, please? Yes, Sir Kyle.
I think it's urethra.
Okay, what its function?
It is a tube that carries urine that takes out urine from body.
Okay. So, would like to answer the next letter? Letter C.
Javier po.
Javier. Okay.
It is the semi-mal vessel po, semi-mal vesicle, because semi-mal vesicles are a sac-like pouch that attach to the vas deferens near the base of the bladder, and semi-mal vesicle make up to 80% of your ejaculatory fluid.
Okay, very good. So, would like to answer the next letter?
Castillo po.
Okay, Miss Castillo.
The answer is prostate. So what is prostate? The prostate is a walnut-sized gland that rests below your bladder, in front of your certum. So the prostate adds additional fluid to ejaculate, which help nourish sperm. So that's
Thank you. Very good. So, would like to answer the next letter? Yes, sir, Hill. Okay, very good. Who would like to answer the last letter, please?
Javier po ulit.
Yeah. Okay, Cleo.
It's a testicle po. Because the
Yes.
testes are responsible for making sperm and are also involved in producing a hormone which is called testosterone, the site of sperm production.
Okay, very good. Now let's confirm your answers if they are accurate. So the first letter is penis, and the second letter is urethra. Letter C, seminal vesicle. Letter D, prostate. And letter E, vas deferens. And the last letter is testicle. So all of your answers are correct. Very good, guys. Can you, clap your hands for your correct answers? Okay. Okay, guys. I hope you've learned something new from our discussion. So if you have any questions, you can ask now. Do you have any questions?
None, ma'am. We don't have any question.
Okay, so there's none. So you will have an assignment that will be passed in our next meeting. So all you have to do is make a Venn diagram, comparing, make a Venn diagram to compare and contrast the similarities and differences between girl and boy puberty. Do you get it, guys?
Yes, ma'am.
yes,
Yes,
ma'am.
ma'am.
Okay. So how was the lesson?
It was very informative.
Okay, thank you. So if you do not have any questions, class dismissed. Thank you guys and see you in our next meeting.
Thank you, ma'am.
Goodbye.
Thank you,
Thank you,
ma'am.
Goodbye.
ma'am.
Bye, ma'am.